And as they do, we'll get started with some background information. Thank you guys all for joining us today for the American Heart Association's Understanding Stroke educational webinar featuring Dr. Robert Groves and brought to you by Banner Aetna. My name is Corinne Kleinschmidt, and I am the Vice President of Health for the Greater Phoenix American Heart Association, and we're very excited to bring this digital experience to you via Zoom today. Before we do get started, there are a few housekeeping things I want to take care of. First, as you heard when you logged on, we are recording this session so that it'll be available afterwards. At the end of the event, you will receive an email with a copy of the presentation slides and a link to that recording. So while we love for you to take notes as we're listening to the presentation, please know that if you do miss something, you will have access to the information again after the webinar. Also, live captions will be turned on automatically for all attendees. And if you'd prefer to experience today's event without those captions, you can click on the live transcript button on the bottom of your Zoom toolbar and then select hide subtitle if you'd like those to be off the screen. For those of you new to Zoom or not using it every day like I do, I'll take a moment to go over a couple tips to help you enjoy the session. First, you can change how you see the speakers on the screen by clicking the word view in the top right corner of your Zoom screen. You can select speaker view to see the speakers better. And then there's several different options you can select. So click on those and see which one you like the best when it comes to being able to see the PowerPoint and the speakers. And of course, now we also need to make sure you know how to ask questions. When you join the webinar, you were given a main event window. If you click chat, you can have the window added to your view. The slide I'm showing you has a picture of what that would look like. You can remove the chat window by clicking chat again and it'll come down. But you can also move the chat window if you pull it up and it's in the way. You just grab it at the top and you drag it with your mouse to move it where you'd like. So now when we have the chat window open, you can type in responses and questions, and you can choose to message who you want, an individual person or all panelists and attendees. So we really encourage you though to send your messages to all panelists attendees. That way we can all see your responses and help to get you answers to those questions. So let's test what we've learned. Open your chat box and type in the answer to this question: true or false? Most deaths from stroke are preventable. I'm pulling up my chat box so I can see as you guys are posting. Remember to select everyone in your options for who you're going to message. A lot of people are saying true. Good job. True. Most stroke deaths are preventable. The most effective way to reduce stroke mortality is to prevent a stroke from occurring in the first place. And we can reduce our risk for stroke by knowing our numbers, making healthier choices, and seeing our doctors for our regular physicals. Now, during the presentation today, please type in the questions, the comments you have throughout. Make sure to select everyone when you get to pick who. And then if there's time at the end after the presentation, I'll go through and we'll answer as many of those questions as possible. As we get started, I'd like to give a special thanks to our sponsor, Banner Aetna, for making this event possible. We're excited to work with them and to provide this invaluable information about stroke and how to reduce your risk. Banner Aetna is an Arizona health insurance company that leverages the strengths of two of the largest healthcare organizations in Arizona, Banner Health and Aetna. Thank you, Banner Aetna, for your support. And today, I'd like to welcome Dr. Robert Groves, who's the Executive Vice President and Chief Medical Officer for Banner Aetna. In his current role, Dr. Groves is responsible for population health management. He received his MD from the Medical College of Georgia and previously served as the Chief Medical Officer for Banner Health Network. Today, he's going to explain what stroke actually is, the warning signs and actions, and how you can reduce your risk to prevent a stroke. Dr. Groves?
Thank you so much, Corinne. It's good to be here. Good morning, everybody. I think that many of you may be asking yourselves, what is the American Heart Association doing talking about stroke? Well, as you'll see as we go through this presentation, so many of the risk factors, the pathophysiology, in other words, the things that happen to blood vessels underlying stroke are the same as those with coronary artery disease or heart disease. So there is a strong relationship between the two, as you'll see. But I want to bring your attention to October 29th, World Stroke Day. and remind everybody that stroke is the #2 cause of death in the world. 1 in 4 people worldwide will have a stroke, 13 million every year, and 1 in 5 of those cases will be fatal. The poster child for unmanaged stroke is Sierra Leone. With the next slide, it's important for all of us to develop our health literacy, and in particular, when we're talking about these major killers, whether it's heart disease or stroke, understanding what it is, what types of strokes there can be, because the symptoms can differ, what the warning signs are, critically important, because like chest pain, if you see any of these signs that we're going to talk about today, it is a medical emergency. Time equals brain tissue, and you want to save that if you can, obviously. And so understanding a little bit about how we treat it will help you understand why time is so important in recognizing signs of a stroke and activating the emergency response system. And we'll also talk about risk factors. And for those of you who attended the last session where we talked about heart disease, you'll recognize many of these risk factors as being exactly the same as those for heart disease. So at least it's easy to remember. There's just one set of risk factors that need to be managed, at least controllable risk factors for both of those challenges. Next slide, please. So, a quick quiz. How many Americans do you think suffer from a new or recurrent stroke each year? And there are your choices to the right. Is it 300, 550, 795, or 1 million? Let's see what kind of answers we're getting here. Come on, don't be shy. Okay, the answer, it turns out, is 795,000. If we fooled you and you thought it was going to be the top one psychologically, then you missed. I was thinking about that actually when that first question went up. Many causes of stroke are preventable. Well, you could have known that fact, or you might have used a little bit of psychology and say, what would be the point of this session if strokes weren't preventable? So kudos to those of you who used every angle to get that one right. The answer here is 795,000. That's a big number. And with the next slide. In the US, remember I said it's the #2 killer worldwide. In the US, it's #4 killer of adults. And I'm going to talk a little bit now about what a stroke is. I mentioned earlier that it's very similar to coronary disease. It's a brain injury, in this case caused by blockage of the supply of oxygen to the brain, which obviously comes through the blood vessels. Now, in stroke, there are 2 different kinds. We'll talk about that in a minute, but the most common kind, I believe it's around 80% of strokes, are because of a blocked vessel to the brain. Now, there are 2 different ways that can happen as well, and we'll talk about that too. But the bottom line is, if there's a large enough vessel so that you don't have other options for getting oxygen to that part of the brain, and it's closed for a long enough time, then you will either get a stroke or a transient ischemic attack. And we're going to talk about both of those. But when you think about this, think of it as being very similar for the vast majority of cases to the same process that underlies coronary artery disease. Let's go to the next slide. So we're going to talk about a couple of types of stroke. And let's move along here. So this is the one I talked about earlier. 87% are ischemic strokes, and that's caused by a blockage in the blood vessel, and that cuts off oxygen supply to the brain. Now, we'll talk that there are a couple of different varieties of ways that might happen that differs a little bit from coronary disease, but the process, the blockage of oxygen being delivered to a vital organ, is the same in both cases. Then there are about 13% of strokes that are caused by a burst blood vessel in the brain and bleeding. And we'll talk about that a little bit too. And next slide. So ischemic stroke, and this is the 2 kinds that I spoke about just a second ago. Thrombus is the same process that happens in a coronary disease. There's a buildup of plaque, and at some point that plaque starts to become critical, such that a small clot begins to form, and if that clot evolves over time, it can close off the vessel. The other type of stroke is called an embolus. An embolus is simply a fragment that blocks the blood vessel that comes from elsewhere. We'll talk about where that comes from. That's a little bit different than coronary artery disease. We don't typically see embolic coronary artery disease, but we can see it in every other blood vessel in the body because it comes typically from the heart. Let's go on to the next slide. The second type of stroke, remember this is about 13%, is a hemorrhagic stroke. There are a couple of ways that this typically happens. It's usually a weakened blood vessel that is a function of heredity and a function of just the luck of the draw. There are things called aneurysms that are malformed blood vessels that can balloon out, weaken, and burst in the brain. And then there's something called arteriovenous malformations, another abnormal cluster of blood vessels that tend to have weaker walls. They're not normally formed. It's hard to know if you have these. I don't say that to scare you, but to say that they're fairly unusual. And there are some things you can do to reduce the risk. And the one that should be obvious to you right off the bat is high blood pressure, right? The higher the pressure you're delivering to a weakened blood vessel, the more likely it is to rupture. And so we want to make sure that we stay on top of that. Next slide. So I mentioned this earlier, transient ischemic attacks. Now, what is a transient ischemic attack? Well, it is essentially a mini stroke that goes away. And it's, you see here, it's a warning stroke. And what happens is there is a temporary complete blockage of oxygen supply through the blood to a part of the brain. And you'll get symptoms related to what part of the brain that is that's been starved of oxygen, but the body compensates and is able to reopen that vessel, and so the symptoms go away. But what that tells you is that there's something very wrong, and if you have a TIA, that's a medical emergency. It's something you want to take care of right away. It's not Monday, you know, after the weekend, or I've got all these plans. That's something you stop, drop whatever you're doing, and get help. Next slide. All right, here's an acronym for those of you who perhaps read up on this prior to the presentation. Not an expectation, but I'll be curious to see if anybody did. What does the acronym FAST, FAST, stand for? Fingers, arms, sight, and toes. And we, Corinne and I were joking earlier that head and fingers, knees and toes was what comes to mind when we start saying these things. That's not it. Fingers, arms, sight and toes, face, arms, speech and time, feet, ability, sight, treat, face, arms, speech and taste. What do you think? Okay, we got some folks that are hitting the mark here. All right, let's show them the answer now, Corinne. Recognize fast. And so what this does is help all of us remember what kinds of things we need to look for in ourselves or in someone that we love, or frankly, anybody. Does one side of the face droop or suddenly feel numb? Is there arm weakness? And is there numbness? And it's typically one-sided. It's usually not bilateral. There's some things that can cause bilateral. Then even severe anxiety, by the way, can cause both of your both of your hands to feel numb and tingly. Typically, when it's a stroke, and by the way, don't ignore any signs that are worrisome, but typically in a stroke, it's going to be one-sided, one arm or the other, depending on which side of the brain is affected. The S is for speech difficulty. And, the classic is that someone is normally having a discussion with somebody, and then suddenly their words start to be slurred. They're unable to speak. They may find it hard to understand you, or they may find it hard to find the words to describe what's going on to you. Don't ignore these signs. If they're in you or somebody you love, get help. And then T is time to call 911. If the person shows any of these symptoms, even if the symptoms go away quickly, it's time to get the emergency system activated and make sure that you're not ignoring something that could lead to long-term disability or even death. Sudden stroke warning. And by the way, there typically is a little bit of a warning for most people. There are catastrophic strokes that happen and there's nothing you can do about it. But most of the time, there is time. And the take-home message is, even if there is a profound weakness or numbness or confusion, if we get to it fast enough, there's a good chance that we can reverse that. And we're going to show you how that's done in a minute. So numbness or weakness, face, arm, or leg, especially on one side of the body. Confusion, we just talked about this, trouble speaking or understanding speech. Next, please. And this is another one, trouble seeing in one or both eyes. Sometimes we want to write that off to something that's localized to the eye, but remember, your brain is very critical to processing visual information. So if you have trouble seeing in one or both eyes that comes on, you can't explain it, think about stroke as a possibility. And again, activate the emergency response system. Trouble walking, dizziness, loss of balance or coordination, all of these can be signs of a stroke, particularly in the cerebellum, which is where we get our balance from typically. So these are all warning signs. With hemorrhagic stroke in particular, can have a very severe headache. And it's often described as worst headache of my life. Don't have an explanation for it. Next slide, please. And women make up 60% of all stroke deaths. Now, there may be reasons for that go beyond a system which has been historically discriminatory, and I will acknowledge that. But women do tend to have some different symptoms, and they can be very subtle. And if you'll read down there what I'm talking about, it's some mild disorientation or fatigue, or just a little bit confused, a generalized weakness. These can be very challenging to diagnose, but if you see any of these, including nausea or vomiting, you need to at least think about stroke as a possibility. And if there's any concern, if you can't make up your mind, it's better to act now and decide later that it was unnecessary. Okay, next slide. Now, when stroke occurs, timely treatment significantly improves recovery. And we're talking about minutes. The quicker you can get to care, the better off you'll be. And the treatment is not something that can be easily delivered in the field. If you get treatment, it usually requires that you get to a healthcare facility. In fact, if it's a stroke, it always requires that you get to a healthcare facility, and we'll talk about why in just a minute. And we have seen dramatic improvements in outcomes, but remember, time lost is brain lost. Every second counts in preventing brain damage. All right. Now, here's one methodology. In fact, it's the most common way. And ALTEPLASE is a clot buster. It's called TPA, usually in the medical profession. And if you can give that quickly for folks who don't have major risk factors for bleeding, because it does help dissolve that clot, but it makes it harder for the body to clot in the rest of the body, for blood to clot in the rest of the body. So we do have to be careful. We have to do a full evaluation and make sure that we deliver this to the right patient. That takes a little bit of time too, to make sure. So the faster you can get to a healthcare facility, the faster you can get treatment. By the way, what happens with ALTEPLASE, and sometimes it's miraculous. You'll have somebody come in with hemiplegia or paralysis on one side of their body. They may also have profound confusion or inability to speak or understand speech. And then they get this clot buster, and you watch those symptoms dissolve away. It can be truly amazing how quickly that can happen with the right therapy. The other intervention that is sometimes used at specific centers is on the next slide. And that is a stent retriever. It's really remarkable, the technology that has advanced in this area. There are actually experts who can go up with a little device through an artery in your arm or your leg, or thread it up into the brain, and even up to 24 hours after stroke onset, they can remove that clot. And it's proven to be effective in at least reducing the disability from stroke. And that's critically important. Every little bit helps. The common complications here are like with TPA, there's a risk of bleeding, and there's also a risk of tearing the inner lining of the blood vessels. Those complications are not unheard of, but they're rare. And when you balance the risk against the potential benefit of significant recovery from the impairments caused by the stroke, many people, if not most, would say, yes, I want to try that. I want to try and get better as quickly as I can. Next slide. All right. Which of these increases your risk of having a stroke? Is it getting older? Is it diabetes? Is it smoking? Is it having blonde hair? Or is it A, B, and C? And I hope all of you get this right. Someone's a comedian, they put blonde hair. All right, let's look at the answer to this one. I don't think this was a really challenging one for this audience. It is, in fact, A, B, and C. The same things that you heard when we talked about heart disease increase your risk for having a stroke. Okay, we're going to watch a brief clip here.
150/90. As a federal law enforcement officer responsible for deterring human smuggling, I felt absolutely bulletproof when the doctors told me to change my diet, go on medication, lower my stress levels, and I didn't listen. You know, just because you feel great doesn't mean that there's not a problem. November 5th, I got off work, went home, and I was playing catch with my oldest son. And then all of a sudden, I couldn't move my left arm. Turned out to be a full-blown major stroke. And then I had my second and third stroke, and followed into brain surgery to repair the damage. Very hard to imagine that I've been termed disabled. I've had to learn to swallow again. My memory is absolutely shot. The foot, I have no movement. Zero. That's, yeah, head to toe. Everything's changed. If I would have followed a treatment plan, I would not be in this situation. I was 40 years old.
I'm going to let that sink in for just a minute. This gentleman's 40 years old and had a stroke. So we're starting to see strokes in younger age groups. There are a variety of reasons behind that. We'll talk about hereditary and physical risk factors for stroke. But I want everybody to notice in that video some of the things that we've been talking about. Obviously, he had profound weakness and inability to use his left hand. His left leg is impaired. So that one-sided symptom is part of the complex. If you noticed, the left side of his face was not as animated as the right, and he had difficulty speaking. These are all the warning signs. And in this case, he either could not be reversed or got in too late to get reversed. At 40 years of age, you might not even consider the possibility that stroke was the cause of whatever symptoms you might be having. All right, so what are hereditary and physical risk factors for stroke? Now let's go on down the list here. Well, obviously, age. Men more likely to have strokes than women, although you will recall that women are more likely to die from stroke. A family history, obviously, just like with heart disease, increases the risk. Ethnicity, there can be risk factors associated with that, as well as a prior stroke, and I think that's obvious. And then again, transient ischemic attack. And basically, it's just like it sounds. It's an attack on the body through the brain that is transient, comes and goes, and it's ischemic in nature, which means blockage of blood flow to a critical part of the brain. All right, let's unpack this a little bit more. Let's talk about controllable risk factors for stroke, and prevention, just like with heart disease, is the very best treatment. So let's list those controllable risk factors. First of all, smoking. The number one thing you can do for your health, bar none, if you're a smoker, is to quit. It's not easy, but there are lots of resources to help you do that. And I would encourage you to continue trying until you accomplish that task. And then there's the silent killer that we've talked about before on this series, high blood pressure. Know what your blood pressure is. There are so many ways that you can get that checked now. There are modules set up all over pharmacies, all over the country. Know what your blood pressure is. And if it's high, get help to get that down. The medications that are used for hypertension now, we've learned that smaller doses of multiple meds reduces the number of risk factors associated with those medications. And so you can get it under control without losing other critical aspects of your life. High cholesterol is also a risk factor for stroke, just like with heart disease. Sedentary lifestyle. We are learning more and more yearly about how important it is to keep moving. Activity is critical. Obesity, we're going to talk about metabolic syndrome now, because this is an epidemic in this country right now. Obesity, diabetes, and prediabetes are ubiquitous. 1 in 3 people, it's estimated in this country, already have prediabetes. Not all of those will go on to full-blown diabetes, but a significant number of them will. And there are things that can be done to slow that process down and even reverse it. And then I mentioned earlier, this was the caveat, that there's a different kind of obstruction of the blood vessel called an embolus. And atrial fibrillation is a prime cause of that stroke type, an embolus to the vessel. In other words, a clot that comes from elsewhere in the body, in this case, the heart, and lodges itself in a blood vessel so that oxygen supply is cut off to part of the brain. And then there's, of course, generalized artery disease, and atherosclerotic artery disease, which can affect any part of the body, but that's also part of the risk profile. All right, let's move on. So what is atrial fibrillation? Well, there are 4 chambers in the heart, the top chambers, which are kind of like the priming pump, and then the 2 big chambers, which pump blood from the left side to the body and from the right side through the lung to pick up oxygen, get rid of waste products out of our breathing. Both of those big chambers can do their job best when those top chambers are functioning normally. And what happens in atrial fibrillation, instead of the coordinated lub-dub that we're all used to, the lub is the atria pre-firing for the ventricles, and the dub is the ventricle firing. And so you can think of it as a coordinated dance between the upper chambers and the lower chambers of the heart. What happens in AFib is that those upper chambers, they get screwed up electrical signals. And so what it looks like is instead of a coordinated lub-dub, it looks like there's a quivering bag of snakes on top of the other 2 major chambers of the heart. And it's a very irregular contraction that is uncoordinated. And sometimes you'll have symptoms with this, but not always. But what happens when that occurs is that blood is more likely to clot in that quivering atrium because it's not getting rapidly pushed along the way it's supposed to. There can be eddies and currents within that irregularly firing electrical activity in the top chamber that allow blood to pool in certain areas, and clots can form. And when those clots form, they can move through the circulation from the big chamber and lodge anywhere in the body. It's not uncommon for them to lodge in the brain because the brain gets so much of the circulation, but they can literally lodge anywhere in the body and cause an ischemic attack to whatever part of the body they go to. If you have atrial fibrillation, we know that it doubles your risk for heart-related death, and it has a 5-fold increase in stroke risk. Managing atrial fibrillation is very complex, and so that's something that you want to talk to your physician about. You may have symptoms like that queasy feeling at the top of a roller coaster right before you go down. That's often described as a symptom of atrial fibrillation. It can also be asymptomatic. So it's good to know and get a regular checkup to make sure that the electrical system is working normally in your heart. By the way, you may just have fatigue and not be able to go as far as you used to. If you're a runner, you can't run like you used to. If you're a walker, you can't walk like you used to, going upstairs, etc. So just know that that's another area to pay attention to, and to pay attention to your own symptoms. Now, we mentioned artery disease, and artery disease can be diffuse. In fact, it often is when we're talking about heart disease. We also see areas in the body that are also suffering from that same problem, and it can be peripheral artery disease. And often the symptoms here are significant cramping in the legs, particularly the calves with walking. It can be, in fact, it's most commonly in the legs, but even stomach pain can be a manifestation of atherosclerotic disease. And so knowing what your health is and what your risk factors are, and having a regular visit with a primary care physician in particular, can help you understand what your particular risks are and what particular steps you may need to take, both in terms of diagnostic studies and in terms of lifestyle management, to minimize those risks long term. Let's see, carotid artery disease. This is something that we hear about a lot. These are the major vessels that are coming up through the neck from the heart that feed the smaller vessels that go to the brain. And carotid disease can certainly lead to a stroke. We're learning more about it. Again, it's very complicated and nuanced. So this is something you want to have a discussion with your physician about. Likely want to see an expert in the diagnosis and management of carotid artery disease. Not as much surgery is needed as we previously thought. There are things that you can do, even with diet, to begin to stop the process and even reverse it in some cases. All right. How about other risk factors? Well, I hope none of these will be shocking to you. Excessive alcohol intake can certainly increase the risk. If you don't drink, there's no reason to start. If you do drink, then moderation is the key. And that means that you're not having more than 1 or 2 drinks on any occasion. When you go beyond that, you start to increase the risk. I'm not moralizing, mind you. I'm just talking about the facts about the risks related to alcohol consumption. Drugs, obviously, the opiate epidemic has significantly increased the risk of stroke, particularly in younger folks. We know this from the data that comes in every day on the opioid epidemic, something we've kind of forgotten about a little bit as we've been focused on the pandemic, but it's still out there. It's not getting better. And so it's something that you want to pay attention to in yourself, in your loved ones. Stay away from drugs if you can. And this one always tickles me. You know, it's not funny, but in a way it is. Please stress less. And sometimes I get stressed out about too much stress and how am I going to reduce my stress, et cetera. But just know that excessive stress over a long period of time is not good for the body. It increases the risks of metabolic syndrome and diabetes. It increases the risks of hypertension. It increases the risk of so many things. So finding a healthy way to manage stress has become paramount in managing your health and reducing your risk of a host of problems down the road, and that includes stroke. There are lots of resources available to you if you want to learn more, if you want to do a little bit of self-study. The catchy name of stroke.org The only thing you have to remember there is it's an org, not a com. And then mylifecheck.org is another great place, as well as managerbp.org that we've talked about before. The AHA has just done some tremendous work in improving health literacy in the country. And that is critical. There's a lot of misinformation out there, but this is a very reliable organization that is evidence-based. And I would encourage you, if you hear something somewhere else that doesn't make sense, go here, check it out, and make sure that you're getting really good information about what the risks are and what you can do about it. And with that, I think I'm going to turn this back over to Corinne and see if we have any questions.
Thank you so much, Dr. Groves. We really appreciate you taking the time to share this information. And on behalf of Banner Aetna and the American Heart Association, I hope you all found today's information beneficial and that you take action and share what you've learned. We do have time for questions, so we'll start with the questions that were submitted during the presentation. If you have additional questions as we go, please type them into the chat box. We might be able to answer all of them, but if we don't, we can definitely answer them by some of the emails as well. So for the first question, when we were talking about FAST, would someone having a stroke have all of those symptoms, or can you just have like one or two?
No, it can be subtle, and this is the challenge, right? You don't want to. All of us, when we're faced with symptoms, are in that place where we go, nah, I don't want to get everybody excited. I don't want to, but they can be so subtle. My best friend from college actually called me one afternoon. He said, I don't know what's going on, but I've got this little tingling numbness that's really weird in my thumb and first two fingers of my left hand, and around my lips gets really numb. And I said, well, you need to go have that checked out. And he did, but he ended up having a stroke anyway. And so my point here is that this affects people you know. If it doesn't affect you or your loved ones, it affects people you know. And the more that people are informed about stroke, the better the outcomes will be. The fortunate thing about my friend is that he sought treatment early enough that he was able to limit the damage, and he has had a full recovery and is back working full time now. It is not a perfect recovery, but gosh, it is so much better than had he waited around and said, gee, I don't know what this is, but it's weird. And it didn't make any direct sense. But it was an occlusion to what's called the internal capsule. And that's sort of the crossroads where lots of interconnections happen. And so it was an odd presentation for stroke. But the key was it bothered him enough to call me. It was enough of a problem that he thought, I don't know what this is. I'll call my buddy. And become the expert in your family, and be that person who can intervene at the right time to really save somebody a lot of heartache and problems and challenges down the road.
So your example is spot on. The information we have shows that about 80% of people who have a stroke, the first person they call is a friend or family member, not 911. So while we want everyone to call 911 first, listening today, hopefully you as that friend or family member, if you get that call, you can tell them to please call 911 now, or to that point, help them and call the 911 if they're having difficulty. So I'm glad you're able to help your friends. We have another question. Can you share why certain ethnicities are at higher risk and which ethnicities are at higher risk?
The answer to that is we don't know exactly why there are all these differences, and likely it is genetic. There are genetic signatures for ethnicities that are unique to those ethnicities. The why is something that we're still investigating. As we get deeper and deeper into the human genome, we may be able to answer that question soon. We may be able to even intervene in some situations with gene editing. That technology is very promising, but today it is not at the point where we can actually intervene effectively at the genetic level. Sierra Leone, you heard, was the #1 stroke capital of the world. There are also some data that African American descent have some increased risk for stroke. And you heard that the symptoms can differ even between men and women. That's probably something to do with a genetic signature. So the real point here is talk to your physician and learn as much as you can about your risk factors. And it's not like you have to keep all of these multiple things in your head because atherosclerotic disease can be heart disease, it can be stroke, it can be claudication, as it's called, which is an obstruction of blood flow to the legs. All of these have the same risk factors. The same interventions are effective in rolling back those risk factors so that you start to minimize your chance of having these things happen. And if you want to take it back a step further, it's estimated that metabolic syndrome in all of its iterations, and remember that's the root source of much of the obesity epidemic. And it has to do with our ability to manage glucose. And it starts with metabolic syndrome. You see the guys with the big waist, the beer belly, it's often called. That's usually a marker for it. High triglycerides in the blood, high blood pressure. These are all markers for metabolic syndrome, which can lead to prediabetes, which means that your hemoglobin A1C, which is a measure of how well you manage glucose in your bloodstream, can be elevated. And then after that happens, if you continue to progress and you don't take any steps to reverse that process, it can lead to full-blown diabetes. And diabetes is a risk factor for stroke, for heart disease, and for all of these other problems. And there are estimates that it may be that metabolic syndrome itself, obesity, prediabetes, diabetes, may be responsible for up to half of what we spend, in other words, the interventions that we have to do in this country today for chronic disease. And if you've read anything, you know that chronic disease has become a major problem for any place in the developed world. And the root causes, if you go all the way back, there are things that you can do that are straightforward. I didn't say they were easy, but they're straightforward. And so talk to your physician and they can give you a lot of help in getting resources to help you stay on track to start reducing your risk.
Perfect. And then questions about specialists. If someone has an arrhythmia or an irregular heartbeat, what kind of a specialist should they see? Yeah,
if you're having an irregular heartbeat, the first thing to do is to see someone, right? At that point, it's not necessarily critical where you get help. Urgent care, primary care, I don't care. Just get in to see somebody, because it's very easy to put an EKG on and determine if your rhythm is normal or not. If it's normal, they may recommend that you be monitored at home for a while to make sure that it's normal all the time and it doesn't just come and go. But then you can be reassured that your symptoms were not related to an irregular heart rhythm. If you do have an irregular heart rhythm, then you're probably I'm a big believer in primary care, and the reason I am is because it's been shown that the mortality in a community is related to primary care coverage. You bring primary care docs into a community and you start to see mortality go down. And it's like, I don't want to speculate on why, but I think a lot of it is relationship, trust, and advice on exactly what we're talking about today. How do I lower my risk factors? What do I do? But that primary care doc may say, you know what, I'd like you to see a cardiologist. And then there's another specialty, a subspecialty beyond that, an electrophysiologist, which is an MD that specializes in irregular rhythms of the heart. And depending on how complex the issue is for you and how you'd like to proceed, there turn out to be a number of options. You may or may not end up seeing an electrophysiologist. They are typically not the ones who manage AFib. AFib is a very common problem. There are very well-designed, expected clinical pathways to follow for someone who has atrial fibrillation. But if there's uncertainty about that diagnosis, which there can be from time to time, or if it's something else, then seeing a cardiologist and then possibly even an electrophysiologist. There are techniques now that can, one of the problems that we sometimes see with a rapid heart rate is that there's a cell or a group of cells in the rhythm system that have, just gotten out of hand. They're rabble rousers and they keep firing off at an unnecessary pace. And they can actually go in with catheters now and zap those guys, take them out of the loop, and your heart can go back to normal. So there are so many things that can be done, but it starts with getting in to see somebody to start figuring out what the problem is in the first place, if there is one.
Okay, and that's great advice too, as far as having a general physician, because that person can help you with all of those other issues as trying to help you to diagnose if you have high blood pressure or diabetes or all of those conditions and help you in a whole body health.
Absolutely.
We have a question about millennials. Millennials and Gen Z are using vaping products as opposed to traditional combustible cigarettes. Is vaping cause increase in strokes just as bad as the other kinds of products? What kind of information do we have on those?
Yeah, we don't have definitive information on that. And that's one of the challenges. It's not something that has been studied extensively to date. What is true is it does deliver nicotine, and nicotine itself can create a variety of problems with vasoconstriction, in other words, constriction of the blood vessels, which can certainly contribute to all sorts of vascular disease. The other problem with vape products is historically the regulation has been light on those. And I don't know if you guys remember, but it was, I don't know, a couple of years ago when we had this whole rash of young kids winding up in intensive care with lung failure. And it turns out that one of the vape companies that was putting this stuff out there had decided that, I think it was vitamin E oil must be harmless, right? It's a vitamin. Well, it's not harmless, and it was destroying lung tissue. And so every time they vaped, they were getting that hit of nicotine, but they were also getting lung damage related to what that nicotine was suspended in. So, there's a lot of controversy here. I can't remember, I think the FDA recently recommended gingerly, if you will, that it may be a rational strategy to help people stop smoking. But that's not how it's marketed. It's marketed to kids, as you point out. And so there's a lot to be learned here. I think if history is a guide, then, sucking anything into your lungs besides clean air is probably not a good idea.
Agreed. I would say that is definitely the stance of the AHA. If it's not clean air, then unfortunately we do not want it into our lungs. We have some questions about testing. So with regard to atherosclerosis, I guess I said it. Are there any tests that you would recommend to help to diagnose if you have atherosclerosis?
Yeah, that's a great question. And if you have the habit of seeing a personal physician on a regular basis, they know you, they know what your risk factors are. It used to be, my dad was they used to call them general practitioners in those days, but he also knew their family. So he had personal knowledge of family history. And I think we lose a great deal as we've gotten away from that. So knowing your family history, knowing your own personal history will guide the kinds of testing that may or may not be necessary in your particular case to determine if there's a risk of atherosclerosis. There are certain things that we know in this country, for example, because of the wave of obesity and metabolic syndrome, diabetes. After a certain age, it's almost guaranteed that you have at least some coronary disease. There's a lot of debate about the best way to identify folks at risk. And the best advice that I can give, and I know I sound like a broken record, but it's so critical, develop a relationship with somebody you trust, with somebody who you feel like is smart and will listen to you. And that's the best person to guide you and determine what tests may or may not be necessary. We know, for example, that routine exercise testing may not answer the question. We used to think it did. Now we know a little bit better than that. EKGs can be helpful, but they are certainly not going to solve all of the mysteries of underlying disease. It is really about controlling risk factors to reduce the chances of this happening, and having a personal relationship with somebody who's smart about healthcare, and typically that's a primary care doctor.
Perfect. And then what about a diet? What kind of a diet would you recommend for lowering your stroke risk?
Yeah, that also happens to be intensely individualized. There are folks who can tolerate carbohydrates, and by carbohydrates, what I mean is, breads, pastas, grains, sugar certainly is the highest offender, the big sugary drinks, all of those things. And it can change over time. In fact, it does change over time. As we grow older, we are less tolerant of carbohydrates. But there are data out there that it is possible to reduce your risk factors eating a Dean Ornish style diet, which is very low in fat and high in obviously vegetables and moderate protein, because it's hard to get a bunch of protein if you're trying to eliminate fat from your diet. So that can work for some people. And there are also some people that on very significant restriction of carbohydrates can reduce their risk factors. We now have long-term data actually on that, and we know that that can help. So understanding what your personal risk factors are, understanding, if you're a vegetarian, then it's a lot harder to do carbohydrate restrictions. Not impossible, but it's a lot harder. If you have good carbohydrate tolerance, then a Dean Ornish style approach might work. If you just can't tolerate that diet, and there are some who can't, then looking to another approach might make some sense. But it's really about you personally in relationship with somebody who understands your risk factors, understands your family history, coming up with a solution that you can maintain long term. And that's the key. Fad diets, on again, off again, probably not going to help. It really is a lifestyle change. And I have to tell you that it's very possible to do that. Surprisingly, even to me, because I didn't have the best diet in the world. But as I grew older, I started to notice that, diet made a big difference. And I made some major changes, and my palate changed over time. What I wanted changed over time. My hunger urges changed over time. So it is really possible to get there. Like so many things, there's a barrier to entry. And what that means is simply that getting from where you are to where you need to be can be a little bit of a challenge. But once you get there and maintain it for a while, what you'll find is you will consider your diet as decadent as any. It's just what you want has changed over time as you've started to feel healthier and your body has adjusted to this new approach to eating.
Thank you so much, Dr. Groves. Those are all the questions we have today, and that's great advice when it comes to making changes for our health and our nutrition. Thank you again, everyone, for joining us for Understanding Stroke with Dr. Groves from Banner Aetna. After the webinar, you'll all receive an email with a link to the recording, a PDF of the presentation, and then a link to a feedback survey. It's a quick survey. Please let us know how we did, what you learned, and how we can do better next time. You might even win a Starbucks gift card. They have very healthy teas, so I highly recommend. Have a great afternoon.
Thanks, everybody.